So in March of 2012, I had the surgery. I had the gastric bypass. I no longer remember exactly what the gastric bypass did, which sometimes it's just, I think, a defense mechanism on my part. I know I've been rewired and my stomach has been made smaller.
As I'm sitting waiting outside in the waiting room, my mother looks at me and she says, "You've already lost enough weight. Are you sure you want to do this?"
So the laparoscopic gastric bypass, again, has always been considered the gold standard. It started out as an open procedure and then moved towards laparoscopic as that technology developed. People lose weight, usually about 80% of their excess weight, so 100 pounds, about 80 pounds, in about a year to a year and a half, so it's pretty quick.
I said, "Mother, I still have almost 200 pounds to lose." No. And then I went into surgery. And I just remember thinking, as of today, you're going to change your life.
What we're going to do is we're going to bypass the stomach. So we cut a little egg-shaped piece out at the very top. And then we're going to reroute by cutting some small intestine that's below, that's called jejunum. We're going to bring that up and sew it to that little egg. And then, so the stomach has a place to drain, we're going to sew that cut edge, the leading cut edge, back into the intestine. So essentially we've created a detour over the stomach and the first part of the small intestine because food's no longer going there. And so it goes from your mouth into that little pouch. It goes down that limb of intestine we've sewn to it called the roux limb. And then it finally mixes with the enzymes and chemicals that are going to digest it further downstream.
I didn't have a whole lot of post-surgery pain. I ended up staying another night in the hospital. My potassium level was low, so they had to deal with that.
So we do it laparoscopically, so small incisions. So pain is there, but it's well managed, usually by oral narcotics for a couple days. You're up the same day. The surgery itself is about 2 hours.
I remember the drinks that they gave me made me nauseous, and so I didn't want to drink them. They made me very, very nauseous, and so that was uncomfortable.
Oh no, this is a real surgery. We try to make it as safe as possible, but there's a breathing tube putting in, you're completely asleep. It's not done under local.
But a nurse had told me before I had my surgery, get up and walk as soon as you can after your surgery because that will help you recover. So I remembered that, and so that was a goal, like within a few hours of the surgery to get up and walk. So what I did is right after they would administer pain medication, it was like, oh, it's my golden hour. Let's do a lap.
Waking up from surgery, you're on pain meds. You don't feel pain.
They were afraid to give me pain medication due to the amount of time I was asleep with the anesthesia.
It is a safe operation, but there is more risk involved with the bypass compared to the other two, just because of all of the cutting and joinings that we have, because we worry about things like leaks, for example, which is where when you're making kind of like pipe tubing, it needs to be an airtight, watertight seal, we worry about a little fluid leaking out that could cause us serious infection. And that's one of the major risks about the bypass.
They wanted me to drink the protein drinks. Oh, this is horrible. This is too sweet. And I thought, wait a minute. When have I ever thought anything was too sweet?
Usually you're in hospital for about 2 days. Usually the recovery for something like the gastric bypass, we're usually looking at about 2 weeks, and this is for a desk job. Heavy lifting, anything really strenuous, you're kind of looking at 4 to 6 weeks.
When I checked out, they don't bring you a wheelchair like they normally do. And I remember saying to the lady, "You don't check me out in a wheelchair?" She said, "Honey, you've had weight loss surgery. Your job is to get up and get moving."
Once you do a bypass, it's kind of it. It is a very permanent operation, so that is something to keep in mind as well.
And it was just very interesting and very funny. They would make me do laps around the hospital. And I think that was sort of eye-opening. But I thought that was great too. It really does make you push yourself.
3 years ago, I decided to have gastric bypass surgery, and I've lost 130 pounds. My life has begun. It gave me so much more than just weight loss.